Most men don't die from prostate cancer, but some do because they made one crucial mistake. And the worst part? It's a mistake doctors won't always warn you about. If you or someone you love is facing this diagnosis, you need to know what actually impacts your survival and what doesn't. There's a lot of fear surrounding prostate cancer, and for good reason. The word cancer itself feels like an immediate death sentence. But here's the thing, when it comes to prostate cancer, not all cases are the same. Some require urgent treatment, while others don't. So how do you know if you have time? How do you know if delaying treatment could help or hurt you? That's exactly what we're breaking down today. Because making the wrong move at the wrong time could be the difference between life and death. Here's something most men don't realize. Doctors often push for immediate treatment, even when it's not necessary. And it's not because they want to scare you, it's because that's just how the system works. Appointments are rushed. Doctors don't always explain whether you have an aggressive or slow-growing cancer. Surgeons push for surgery because that's what they specialize in. Fear makes men say yes too quickly without understanding their real options. And that's how so many men end up with life-changing treatments, radiation, surgery, hormone therapy without knowing whether they truly needed them in the first place. So here's the big question: can you afford to wait? Or do you need to act right now? This is where things get tricky. The timeline for treatment depends on one thing: how aggressive your cancer is. And that's measured using something called the Gleason score. 1. If you have a Gleason 6 low-risk cancer. Here's the truth: most men with a Gleason 6 don't need treatment right away. In fact, some may never need it at all. Research has shown that these cancers grow so slowly that active surveillance monitoring instead of immediate treatment works just as well as surgery or radiation. What does that mean for you? You have time. If you're diagnosed with a Gleason 6, don't let fear rush you into a decision. Instead, get a second opinion. Ask about active surveillance. Consider your quality of life before choosing aggressive treatment. 2. If you have a Gleason 7 intermediate risk cancer. This is where things get more complicated. A Gleason 7 means your cancer is more likely to grow and spread, but not always at an alarming rate. Here's the key: you usually have weeks to months, not days, to decide on treatment. Studies have found that a short delay up to 6 to 12 months doesn't affect survival rates. So what should you do? Get more testing. PSA levels, MRI scans, or even genetic testing can help determine how aggressive your cancer really is. Weigh your options: radiation, surgery, or hormone therapy each have pros and cons. Understand the risks. Treatments can impact urinary function, sexual health, and overall quality of life. 3. If you have a Gleason 8, 9, or 10 high-risk cancer. Now, this is where urgency matters. A high Gleason score means your cancer is aggressive. And while even the most aggressive prostate cancers don't spread overnight, time is more limited. Here's the reality: a delay of 2 to 3 months usually won't affect survival. But beyond that, things get riskier. If you're diagnosed with high-risk prostate cancer, don't panic, but don't delay for too long. Get a full workup: PET scans, bone scans, and additional blood tests to see if the cancer has spread. Consider combination treatments. Radiation plus hormone therapy is often more effective than surgery alone. And most importantly, make sure you have a doctor who specializes in prostate cancer. Many general urologists don't stay up to date on the latest treatments. You need someone who does. So why are men pushed into treatment so quickly? The answer is simple: fear plus the medical system. Doctors don't have time to explain options. Most appointments are 10 to 15 minutes long. That's not enough time to process a life-changing diagnosis. Surgeons tend to recommend surgery. Radiation oncologists recommend radiation. Everyone pushes what they know best. Patients want to get rid of it immediately. The idea of waiting feels unbearable, even when it's the smarter move. But here's the truth: rushing into treatment can cause more harm than good. Surgery can cause permanent erectile dysfunction and incontinence. Radiation can lead to long-term bowel and bladder problems. Hormone therapy can cause fatigue, weight gain, and depression. And if you didn't actually need aggressive treatment, you've just traded one problem, cancer, for another, side effects you may never recover from. So can you beat prostate cancer in time? The answer isn't black and white. It depends on your specific case. If you have Gleason 6, you almost always have time. Monitor it carefully. Gleason 7? You likely have months to decide. Get more tests before rushing into treatment. Gleason 8 to 10? Time is shorter, but a small delay 2-3 months won't drastically change survival rates. The biggest mistake men make? Letting fear decide for them. Instead, take control. Ask questions. Get second opinions. Demand more information. Because beating prostate cancer isn't just about treating it, it's about treating it the right way, at the right time. Subscribe for more health insights or watch the next video to learn the most common prostate cancer myths that could be putting you at risk.